Well, some people in the upstate are not coming back for their second dose of the COVID-19 vaccine, which defeats the purpose, really. It's a problem both Prisma Health and state health officials shared with us, and there are reasons why you need both doses of Moderna and Pfizer to protect yourself from the virus. So our own Teresa Bowles has been looking into this for us, and she's going to explain why it's so important. Teresa?
Cody, after going through the CDC's information, the vaccine companies and DHEC, they all agree that you need to complete the series for 2-dose vaccines. That way you're fully protecting yourself and others.
Nora was born at 32 weeks.
For Nora and Niles, Amanda Kennedy chose to get the Pfizer vaccine.
Her being premature and my son being in preschool, we just want to protect them the best that we can.
And that means both doses, but DHEC says some patients have been skipping out on their second shot.
When I see that people are getting their first COVID, but then they're either intimidated by the second one or some people are lazy, it's really disturbing to me because you're not protecting your loved ones.
I read through the trials for both Moderna and Pfizer. One dose drops you down to a lesser percentage efficacy at protecting against COVID-19. For Pfizer, it's between roughly 30 to 80%, and for Moderna, 40 to 80%.
From what I've learned is that the first one is really just to prime your immune system, and it gives you some antibodies, but not all that you need to fully protect yourself and protect others.
Nikki Candell received dose number 2 without question.
I work in a labor and delivery hospital, so I'm around pregnant moms and babies who usually have a little bit lower immune system, so I wanted to protect them.
The CDC says with dose 2, that protection jumps to 94.1% for the Moderna and 95% for the Pfizer vaccine. And you still have to wait 2 weeks afterward before you can say you're fully immune, which Kennedy says is the right thing for her to do to protect her family.
I don't think that COVID's going away unless some of us start stepping up and getting the vaccine.
And I'm one of the lucky ones that is stepping up to get the vaccine tomorrow. And before I could even get an appointment, I had to go ahead and schedule that second dose. But the CDC says if you do miss your second dose, you can take another dose up to 6 weeks after the first. Live in Greenville, Teresa Bowles, Fox Carolina News.
All right, Teresa, thanks so much. And remember, if you want that one dose, you'll need to check with Johnson & Johnson to see where it's at. But right now, that is a pretty hard shot to get.